Mr. Rajesh Sharma, a 55-year-old businessman, had undergone a routine hernia surgery the previous day. The operation had gone well, and he was expected to go home the next morning. Inside room 403, the mood was cheerful.
You always choose the worst possible time to fall sick. Our daughter's wedding is less than a month away.
Relax, Maya. Tomorrow I'll be discharged. Then I'll personally supervise arrangement.
Papa, first recover.
For the Sharma family, it seemed like just another ordinary evening. None of them knew that within a few hours, a race against time would begin.
Sharma ji?
Something felt wrong. Mr. Sharma wasn't moving. His chest wasn't rising.
Sharma ji, please wake up. Sharma ji, do you hear me?
No response. Panic rushed through her body. Quickly, she pressed the nurse call button. Within seconds, Nurse Meera rushed into the room. Her experience and trainings made her recognize the danger instantly.
Sir, can you hear me?
She checked Mr. Sharma's pulse and responsiveness. Nothing. Quickly, she pushed the code blue alarm.
Code blue, room 403. Code blue, room 403. Code blue, room 403.
The Code Blue team on duty at that time consists of 6 trained members. 1. Senior physician Dr. Madhav as the team leader. 2. Dr. Sudha, the anesthesiologist. 3. Nurse Fatima, trained in critical care. 4. Nurse Riddhi, the medication nurse. 5. Nurse Naina, the IV nurse. And 6. Male nurse Raghu, who handles the defibrillator. Dr. Madhav and Dr. Sudha were trained for advanced cardiac life support, while other team members were trained for basic cardiac life support. As soon as the Code Blue announcement echoed through the hospital, they immediately paused their work and rushed toward room 403. Meanwhile, Nurse Meera cleared space around the bed, lowered the side rails, exposed his chest, and positioned him to begin CPR. Meera had never performed CPR on a real patient before. Her only experience came from the CPR training workshop she had attended, where she had practiced repeatedly on a mannequin. For a brief moment, doubt crept in, but she quickly steadied herself and regained her confidence. Drawing on everything she had learned, she moved into position beside Mr. Sharma. She placed the heel of her dominant hand at the center of his chest and positioned her other hand on top, interlocking her fingers. Keeping her elbows locked straight and her shoulders directly above her hands, she prepared to begin chest compressions. The voice of her CPR instructor echoed clearly in her mind. Push straight down, 5 to 6 centimeters deep. Maintain a rate of 100 to 120 compressions per minute. Count steadily in your head. 1, 2, 3, 4, all the way to 10, and then repeat. The Code Blue team arrived in less than 2 minutes. Dr. Sudha immediately took over chest compressions from Nurse Meera. Nurse Meera gently guided the distressed Mrs. Sharma away from the bedside and did her best to comfort her. At the same time, a nurse and an attendant hurried in with the crash cart. By design, the hospital stations these carts on every floor, keeping life-saving equipment just a heartbeat away during any cardiac crisis. The crash cart trolley was arranged in following manner. The top surface had defibrillator and monitor, a cardiac board, and bag valve mask for both adults and pediatric size. These are used for immediate resuscitation. Drawer 1 had airway and intubation tools such as laryngoscope set, ET tube, and accessories. Drawer 2 had emergency medicines such as epinephrine, atropine, vasopressin, etc. Drawer 3 had things for IV setup. Drawer 4 has vascular access and secondary supplies. Drawer 5 had procedure-specific and miscellaneous supplies such as chest tube insertion trays, NG tubes, and catheterization supplies. Oxygen tank, portable suction apparatus, and replacement extension cables are attached on sides and bottom shelves. After 30 chest compressions, Dr. Sudha paused. Nurse Naina quickly delivered 2 breaths using a bag valve mask, ambu bag, from the crash cart. The next cycle of chest compressions began immediately. Meanwhile, Nurse Raghu retrieved the defibrillator from the crash cart and placed the pads on Mr. Sharma's bare chest, one on the upper right side and the other on the lower left, while chest compressions continued. Immediately, the monitor began displaying Mr. Sharma's cardiac rhythm. "Clear!" shouted Dr. Madhav. Dr. Sudha immediately paused chest compressions, and the team turned their attention to the monitor. The team is looking whether the monitor shows a normal, shockable, or non-shockable rhythm. If the monitor shows a shockable rhythm, such as ventricular fibrillation, electric shock using the charged defibrillator can be ordered to help restore a normal heart rhythm. If it shows non-shockable, such as asystole, flatline, defibrillation would not be indicated, and chest compressions would resume immediately. For Mr. Sharma, the rhythm was non-shockable. "No shock! Resume compressions!" shouted Dr. Madhav. Without losing a second, the team continued CPR, maintaining the 30:2 cycle of chest compressions and rescue breaths. Dr. Madhav also ordered to inject epinephrine, which Nurse Naina immediately did. This constrict blood vessels and force oxygenated blood towards the brain and heart muscle. Outside the room, Mrs. Sharma was in tears.
He will be all right. Our team will take care of everything. We are doing our best.
Staff ensured that Mrs. Sharma is comfortable. Inside, the code team relentlessly continued 30:2 compression and breathing. After 2 cycles, Dr. Madhav again ordered to pause and looked at the monitor. This time, they saw a normal rhythm. With hope, Dr. Madhav quickly checked Mr. Sharma's pulse.
Strong pulse, ROSC. Stop CPR and shift the patient to ICU.
ROSC, return of spontaneous circulation. It means Mr. Sharma's heart is beating again. He is out of danger. Everyone was relieved. Within 11 minutes of their arrival, the Code Blue team saved a life. Nurse Raghu documented all the key details in the Code Blue form, which will be used later for post-event analysis. Mrs. Sharma got the good news. Tears rolled down her cheeks as relief and gratitude replaced her fear. After 4 more days in the ICU, Mr. Sharma had recovered well and was declared fit for discharge. As he left the hospital with his family, their hearts were filled with gratitude for the team that had saved his life. Mr. and Mrs. Sharma hosted a grand wedding celebration for their daughter. Among the most honored guests were Nurse Meera and the entire Code Blue team, the very people who had given Mr. Sharma a second chance at life.
You saved my life. I will be thankful to you forever. It's our duty, but as of now, we are here to enjoy the wedding dinner.
A well-designed Code Blue system and a trained response team can mean the difference between life and death.